RH everyone, we are the group 1 and we're going to explain about the positive, negative, and advantages and disadvantages of RH law.
Dear men and women, have you ever heard of reproductive health? If you do, well, good for you, because there are a lot of people who remains unaware and unenlightened with the so-called reproductive health.
So we are here to discuss the definition and the summary of the RH law.
What is reproductive health?
The Responsible Parenthood and Reproductive Health Law of 2012, often known as Republic Act 10354 or the RH Law, is a national policy that requires the Philippine government to fully fulfill the requirements of its citizens with regard to responsible parenthood and reproductive health.
Who signed the Reproductive Health Law?
Former President Benigno Simeon Aquino III signed the RH Law on December 18, 2012. This historic law ensures that all people, including those in underprivileged areas, have free access to nearly all modern contraceptives at government health centers. The law also stipulates that women have the right to care following an abortion as part of their right to reproductive health care, and that reproductive health education must be taught in public schools.
The summary of this presentation that you've seen in this laptop is, in this organization, this focuses the reproductive health issues throughout Asia. In the Center of the Reproductive Rights, they address that the material rights, it should be in the India and throughout the Philippines. And the modern contraception is to prevent the woman protective their reproduction health. Then the Center of Human Rights it was released on March 2011. The right is the contraceptive. The information and the services for women and adolescents is that to stress out and to access planning and information and services to the family.
So we discuss the positive attributes of RH law. So we discuss the benefits sa positive attributes sa RH law.
So first one is family planning information and services.
So family planning is very important. Kung once gani mo kuan kag pamilya, dapat if ganahan mo anak, dapat kaning namoy plano na makasustenso ba mo ani na kuan kaning sa imong mga anak kung magdungag mo anak.
So second one is maternal, infant and child health and nutrition, including breastfeeding.
So very important no if natay bata na magpa-breastfeeding jud ta sa atong anak.
So next is prevention of abortion and management of post-abortion complications.
So ang kaning abortions is kung kuan na jud kay no. So planuhon jud nimo kung once gani kaning makasustenso jud kag bata, dapat kaning dili ka mo kaning sa tawag abortions sa kana na bata kay di ka magtuga-tuga og kuan panganak og kuan kana.
Next is adolescent and youth reproductive health guidance and counseling.
So kita mga youth dapat makaibaluta sa unsa jud mas maayo para maka-prevention sa ato sa kalakuan unsa pagbuhat sa bata. So kung diri ang katong kondom, dapat mag-use jud ta ni kondom if magbuhat man gani para iwas kuan lang.
So next is prevention and management of reproductive tract infection. So HIV, AIDS and sexually transmittable infection.
So HIV is kaning digital magpataka ano kay wata kay baw na kanang tawo imong gikuanan kanang imong gikuanan ana kay kaning na HIV so digital magpataka.
So next, elimination of violence against women and children and other forms of sexual and gender-based violence.
So kata mga babae is naadyo tay dapat ato ang kaning sa ito gana dili ta abusaran gani sa atong pagkababay kay kita bay luoy pud bay kita mga anak-anak.
So next, education and counseling on sexuality and reproductive health.
So kita mga youth dapat ma-educate ta sa sexuality sa reproductive health. So mo to ang mga benefits sa RH law katong mga positive namong ipang-explain. Mo dili lang pud sa mga babae ug sa mga laki kita tanan pag ma-involve pud ani law.
We're going to talk about the advantages and positive feedback laws. So first is we're going to talk about the midwives for skills, and birth attendance. So first is every province and municipality is required to have a suitable number of midwives and other trained attendants. And next is hospital-based family planning. So it talks about this like delivery of the clients of information about the condoms and injectable things.
Contraception as an essential medicine. Reproductive health products will be regarded as an important medicine and supplies. So, contraception like pills and vasectomy. Ang pills is kanang mga gipanghatag sa school, inanay. So, importante gid na siya aron protection kung namang gani mo plano nga kaan buhat og bata inana. So, reproductive health education. RH education must be provided in age-appropriate way by appropriately educated instructors. So, like sa atong subject, human reproduction is gi-aware ta nga malikay ta sa teenage pregnancy or naay family planning sa every family nga magbalak o magbuhat og bata.
Next is the other relevant ideas and result of RH respectives. The Responsible Parenthood and Reproductive Act of 2012, often known as the RH Law, is a landmark statute that ensures universal and free access to practically all modern contraception at government health clinics for all residents, including unprivileged population. The legislation also mandates the teaching of reproductive health in public schools and acknowledge the woman's right to post-abortion care as a part of her right to reproductive health care.
Access to modern and composition of Filipinos of women will retake control and their poverty health and lives in said nonsense. North Cap and President Chef survey offer the center of the reproductive rights. The profession, health and law, historic, the forward in women, the Philippines along to make the health and family decision, engage the complete and the equivalent in society.
So, RH Law, it is a Reproductive Health Act. So, basically, i-control niya ang population through giving knowledge and seminars sa mga committees or sa schools para ang mga kababaihan and kalalakihan is kanang naa sila'y knowledge about anang mga sa pregnancy, family planning, and etc. Tapos, under pud ana kay naay free access ang tanang residents sa ilang mga healthcare clinics sa free contraceptives, and ang pasabot ng contraceptives is like pills and condom and etc.
So these are the negative attributes of RH law. The contention of Bill's opponents that there is no population concern is neither supported by rigorous empirical research nor by surveys of public opinion. Although high population increase may not be regarded as the primary reason of the country's economic backwardness, it is one of the most significant contributing factors. True corruption is most likely the country's greatest obstacle, but it cannot be the primary focus of the nation's development efforts. Many of our Asian neighbors have likewise been beset by varied degrees of corruption, but they have yet achieved economic vitality by combining excellent population policy with fair economic measures. Furthermore, the claim that a big population due to the rapid expansion is beneficial to the economy is sharply contradicted by the facts. If this were true, the Philippines, whose population has been expanding the quickest in Asia, with the Nepal and Pakistan, should have the most successful economy and the least amount of poverty. Unfortunately, these three nations have the region's most lagging economies.
Next is the disadvantages and other feedbacks and results of RH law. First is Reproductive Health Bill. undermines the human rights it seeks to advise. So the government cannot guarantee the universal fundamental human rights to reproductive health and the freedom to make free and informed decisions while advocating a policy that instructs parents, especially women, what to do. This attitude insults the poor dignity and capacity. The measures promises to value natural and artificial family planning equally is false. In the bill's budget, the natural family planning methods are mentioned but funded. Natural techniques require education and expertise to help women control their health and make educated decisions. The measure must include budgetary provision to train knowledge-based productive healthcare practitioners and promote informed choice for women. So, government cannot guarantee everyone to their productive health or even their freedom to choice or to choose what they want to do. So, in short, the people will or pili ra ang mga tao nga maka-choose sa ilahang freedom or maka-express sa ilang feelings. So, natural or artificial family planning is equally but false daw siya. Kay bills ang budget daw sa atong government which is sa family planning methods is not dili siya funded by the government. So it will also promotes the healthcare practitioners and also the choice for women. So next.
Second is maternal health requires access to healthcare facilities and reproductive health education, not contraceptives. So the RH bill's mandate to expand obstetric care and qualified birth attendance is not stressed in this draft. Hemorrhage, infection, obstructed labor, and hypertension cause maternal death and morbidity. Investment in trained birth attendants and health education for women and families can dramatically reduce these causes. So, ang mga cause sa maternal health, ang kaning mga hemorrhage, infection, obstructed labor, and hypertension. Mo siya ang mga cause sa maternal death and morbidity. The Philippines reproductive health will not improve more. According to the UNFPA, experienced birth attendants might prevent 3 to 4 of maternal fatalities. However, family planning may only cut maternal fatalities by 1 to 3. The RH bill's maternity care measures are necessary yet indicate.
So this is the other two disadvantage of RH law. It does not protect the rights of conscious of those that will be responsible for implementing new measures. This measure requires reproductive healthcare worker to provide information and education and offer medical treatment. This legislation does not safeguard religious or cultural conscious objection by healthcare practitioners or organizations. Number 2, it violates freedom of expression. The bill punishment of communication that malicious engage in misinformation concerning the RH bill substance or even prospective intentions breaches the fundamental right to free expression and expression. The clause should repealed entirely. So number 1, it means the other disadvantage of RH law kay dili siya supportan to di siya related to cultural or di siya supportan into religious community. It violates freedom of expression. So kasagaran na kay mga dili kay ka afford og mga mamahalon. So dili sila ka express ilang expression kung unsa ilang dapat ma-express. So those are the topic that we present And that's all for RH Law. So thank you everyone and good day.
In the Philippines, Republic Act No. 10354, or the Responsible Parenthood and Reproductive Health, or RPRH Law of 2012, guarantees and enables measures for the sexual and reproductive rights of individuals.
However, studies show, contrary to what the purpose of the law, according to the Philippine Statistics Authority, 36% of births in the Philippines are either unwanted or mistimed. 5.99% of Filipino girls experience teenage pregnancy.
But we're not here to complain,
but to help.
The lack of awareness of the law, its provision, purpose, benefits, and regulations.
Authorities shall conduct inclusive programs guided by the government to educate and promote equal access to the laws, rights, obligations, and its regulations concerning the reproductive health law.
Proper and adequate information dissemination is lacking, leading to the refusal in availing products and services.
When it comes to contraceptives, couples in legal age must be integrated with the knowledge, with the use and purpose.
Accessing services is difficult and expensive on rural areas.
Reach out to residents in rural areas, and the government shall establish health facilities that can do complex health services, one of which is the Alert or the Advanced Local Immediate Response Team.
Sex education and school curriculum.
Too many young people receive conflicting and confusing information about relationships and sex. Age-appropriate lessons under the supervision of the Department of Education to help the students at a young age to have a clearer view of their reproductive health.